We've got some talented people here in the Charlotte area and beyond. A lot of people with a lot of talent. I'm Colin Mayfield here alongside Jeb Goldman inside the Impact Studio on WCNC Plus. We appreciate your time. We'll be here for the next hour, and then we'll toss things over to Nick Sturdivant and Jane Monreal for our WCNC newscast, our linear show. But we do have something in progress right now. There's been a lot of discussions, and actually Senators Chuck Schumer and Kristen Gillibrand, they spoke about the cuts to the World Trade Center health program, and they are actually doing a press conference on this, again, calling to action the president and Congress to make sure that they fund this program that's been really influential in a lot of these men and women's lives that put their life on the line for us on 9/11. So we'll go to this. This is in progress right now.
There's alive. They say John Howard has been reinstated, but we have no confirmation that he's been reinstated, and we don't know if he's reinstated continually or just until June 2nd. That is what we are up against, chaos and confusion. Even if Dr. Howard has been reinstated, the staff at NIOSH and the CDC are still fired. As a result, we know the World Trade Center Health Program stopped approving new cases. It stopped enrolling new patients, and it had to turn at least 3 sick patients away. HHS reversed course again and began approving new enrollments, and those patients are now receiving care. But again, for how long? We actually asked those patients to join us today. Unfortunately, they were too sick to come. One has a life-threatening pancreatic cancer, and while he and the other 2 patients are now getting treatment, the truth is they shouldn't have been turned away in the first place. For people as sick as they are, care delayed is the same as care denied. Meanwhile, we have Secretary Kennedy lying on Fox News saying that he hasn't cut the program. We know that is not true. He doesn't even seem to understand what the program is called. It's an outrage and it's absurd. Tomorrow, Secretary Kennedy will appear before the Senate Committee on Health, Education, Labor, and Pensions, and we need to hold him accountable. I'm working with my colleagues in the Senate to demand answers, and I'm also sending a letter to Secretary Kennedy's office requesting the basic information that we need. What is Dr. Howard's employment status? Whether the program is enrolling new patients and members, certifying new treatments. How many staff critical to the work of the World Trade Center program remain? These are basic questions that he has to answer. September 11th, 2001 was one of the worst days in America's history, and the traumas that so many Americans endured as a result live on in those communities and in those families today. It's why the American people made this solemn promise to never forget the sacrifices of our first responders, and why we World Trade Center Health Program in the first place to give them care. So we will not waste any more time fighting for our first responders and family members. We are demanding answers, and we're demanding them now. Senator Schumer.
Thank you, Senator Gillibrand, and thank you for your great leadership here. I want to thank our advocates as well, John Field, Thomas Hart, Andrew Ansborough, Mariana James, and so many others. Now, we're here today because of our sacred promise, never forget. And that sacred promise is under attack. Ever since he was confirmed, Robert Kennedy Jr. has tried to gut the World Trade Center Health Program. Not trim, not tweak, not fix, but gut. Just look at the chaos that's been swirling over the last few weeks. Doctors and staff who manage and provide care to our sick 9/11 first responders fired, some rehired, others fired again. Total chaos. And this is the last place on earth where there should be chaos, because people are sick and people are dying and people need their health care. The firefighters and heroes who work the pile, helping rebuild after the darkest hours in America, are sick with cancer from the toxic air they breathe and other illnesses as well. Many are dying. Is this how you treat their health care? Up to 800 first responders, up to 800 have had their enrollments halted. As many as 1,200 written treatment approvals have been stopped. These are approvals that are needed, whether it's for a medicine or a treatment at a hospital, stopped. And people get sicker, and people are less likely to live when that happens. As Kirsten said, Dr. John Howard, the great director, was sent packing. Then he was supposedly reinstated. For how long, nobody knows. He doesn't know. Now, this infuriates me. I met with Senator Kennedy before his confirmation. I asked him would he protect the World Trade Center Hope program. Kennedy looked me in the eye and committed to protecting the World Trade Center Health Program. He lied. Kennedy lied. He has broken that commitment, and now he'll have to answer for it because I know there will be questions asked of him at the committee tomorrow. Kennedy told me he had friends, acquaintances who died on 9/11. Well, has he forgotten them? What about those people? He looked me in the eye and said, I remember those people. Democrats are going to hold Senator Kennedy's feet to the fire. We're going to demand answers about his betrayal of 9/11 heroes. We'll demand answers about the cuts and the firing. We'll demand answers about the chaos, confusion, and uncertainty. No more broken promises. No more empty statements from Kennedy. We need the truth. We need the truth on what happened and what they're doing at the World Trade Center Health Program. We need them to firmly commit and publicly to never cut this program again, never cut it again, to never cut the health care or the workforce of this program again. My message to Secretary Kennedy and to President Trump is this. If you think you can quietly gut the World Trade Center Health Program without a fight, you are dead wrong. Senator Gillibrand and I, and all the advocates here today will never let up. The health care of our 9/11 first responders is not government waste, Mr. Musk, Mr. Vote, Mr. Doge. It's sacred human life. Gutting the World Trade Center Health Program is not efficiency. What it is a different word, cruelty, meanness, anti-American. The World Trade Center Health Program, because of the people here, many of them, took years to build. It took the courage of many folks. Some of the folks are here today, some of them are gone, who walked the halls and are now gone, succumbed to the illnesses they acquired on 9/11. But because of the work of those people and the people here, it's the law, not a whim, not a maybe, not if I want to, a law. And now Kennedy is trying to take that all away in the blink of an eye. The chaos and confusion that this administration has created will not blind us to the reality. What they are doing is not never forget. What they are doing is screw you. That's a total betrayal, and it won't happen on our watch. Senator John Field.
Thank you, Chuck. Sir.
Yes, sir.
I'm just going to say what everybody else is thinking. Kennedy, you're a fucking liar. It's that simple. The secretary is disingenuous. The secretary is uniquely unqualified to hold any government position. But what are we doing today?
Sorry about that, folks. That is a live feed. We apologize if you heard any vulgar language there. We will try to make sure we get to another type of shot in just a couple of seconds here if we need to. We're going to stick with this, though. Just be aware, though, this is a live feed, so you may hear some more language like you just heard here on this 9/11 Heroes conference discussing this Heroes Fund and what they would like to see from Congress and the President and how this is helping people as well. So we'll go back to it.
Him sick, heart sick, him sick. Instead, we created the World Trade Center Health Program. That was their apology. Create the World Trade Center Health Program, give them free care, health care, then make us walk the halls of Congress and get it extended to 2090. And then to gut it, you took your own apology away from us. Mm-hmm. So what are we talking about today? You know, if Dr. Howard was an illegal alien, we'd know his fucking status. Serious. What's Dr. Howard's status? What happens on June 3rd? See, when they gutted NIOSH and Dr. Howard got fired, a fragile fraternity of 140,000 people were up in arms. The healthcare stopped. Now they're all wondering what happens June 3rd. So we stand here today. We have to go back and worry about those 140,000 people who don't know their future. So what are we doing today? I mean, I want to talk about, we'll be back here next week having 30-plus meetings for HR 1410 and S 739. So is Kennedy going to come out and make a public announcement before tomorrow's hearing when he gets a new one ripped? Because Senator Kaine, Senator Kim, I want to thank them because I know they've been watching this. So is he going to come out and publicly say Dr. Howard is permanently reinstated? Are those doctors permanently reinstated? Those doctors that ensure the enrollment and the certification process rolls? Is Kennedy going to come out and say he's not going to mess with us anymore? Is Kennedy going to come out and say, you know what, I support HR 1410 and S 739? Is the administration going to support HR 1410? Because the administration can just say, hey, everybody in Congress, support HR 1410. You know what? There's a thing, that reconciliation that they're doing right now, they can slip us in there. We can all be gone, and John Peel doesn't have to curse in front of everybody. But today, we're here, and what are we doing? We're fighting the boogeyman. Who's our enemy? Kennedy? He's an idiot. Again, grossly unqualified to hold any position in the United States federal government. What an incompetent, arrogant, dumb, stupid, repulsive fool to recklessly, without any humanity, hurt 140,000 people. If you're not angry, then you're not human. Have a good one.
Thank you, everybody.
Thanks, Chuck. I'd now like to invite up Thomas Hart, our president of Citizens for Extension of the Droga Act and president of Local 94, International Union of Operating Engineers.
Thank you. Thank you, Senator Schumer. Thank you, Senator Gilbride. John, today we're here for two things. We're here to say thank you to the people who have continued to support our fight and our effort from day one. These people behind me and the people that have gone before you, people that have gotten sick, the people that have been shut down, have risen from the ashes and the chaos and the confusion. We know about chaos, confusion, dark times. These people answered the bell. They were there for it. Chaos and confusion are nothing new to us. We're pros at it. What's going on today is an atrocity. We're here today also, John, to hold people accountable for the things that they're doing. That's what's got to come out of today, tomorrow, and every day forward. People need to be held accountable for what they're doing. I hope that people have the courage to ask those questions tomorrow when he's sitting on that floor, because he is not qualified to do the things he does. John Howard came into a time of chaos, confusion, and probably produced one of the most successful programs that this country has ever seen coming out of this Capitol building. The man is a hero. The way he's being treated is completely disrespectful. Think about being diagnosed with cancer when you answered the bell. 15, 17, 18, 20 years later, you come down in the gestation period with cancer. Because in the deepest, darkest times of our country, in my city, the city of New York, it hit close to home. Now they're being told that they're not going to have anybody there for them. Nobody wants to talk about the mental health aspect of what we're dealing with. Think about that if that was your aunt, your uncle. Think about what they're thinking about. There's nowhere to turn. They're scared to death. The only thing facing them is death because we turned our backs on them. Never forget. I know in my local, we will never, ever forget. These folks here, they're never going to forget. And guess what? We're never going away. So tomorrow, please have your colleagues have the courage to stand up the same way these people have, and we'll continue the fight. Thank you.
Thank you. Now I'd like to invite up Andy Ansbro, the president of the Uniformed Firefighters Association for Local 94 IAFF AFL-CIO.
Thank you, Senator Gillibrand and Senator Schumer, for having us here, and everyone for coming back down again for this important work that we do. I come here representing 20,000 active and retired New York City firefighters, including all of the 9/11 first responders that are still alive, myself included.